Welcome back, everyone. Today we are talking about the body's first line of defense, our skin. Dr. Sarah, I like to think of the skin as a high-tech suit of armor. It's flexible, it's waterproof, and it's usually great at keeping the bad guys out. But even the best armor has seams, right? And when those seams fail, we get into the messy world of skin infections.
That's a great analogy, Dr. Khan. From an academic standpoint, we need to remember that this armor is divided into two distinct layers: the superficial epidermis, which is that stratified epithelium, and the deeper dermis, which is the heavy-duty connective tissue. When we talk about infections like paronychia, boils, and carbuncles, we are really talking about what happens when pathogens, usually Staphylococcus aureus, invade the skin's appendages. These are the nails, hair follicles, and glands that actually dip down from the surface.
Exactly. The appendages are like the service tunnels into the fortress. Let's start with the one I see all the time in the clinic, paronychia. This is that painful red swelling right where the nail meets the skin. Patients usually come in because they were biting their nails or had a nasty hangnail. But why does this matter clinically, Sarah? It's just a little finger swelling, right?
Well, for the boards, you have to be precise. Paronychia is specifically an infection occurring between the nail and the nail fold. The nail fold is that flap of skin that overlaps the proximal and lateral edges of the nail plate. If that seal is broken, bacteria rush in. Clinically, it matters because if it's not treated, an abscess can form, which might require incision and drainage. It's a high-yield bread-and-butter diagnosis.
And it hurts like crazy because that tissue is so tight. Now, let's move to something a bit deeper, the classic boil. In medical terms, we call it a furuncle. I tell my students to think of a hair follicle like a deep well. Attached to that well is a sebaceous gland, which is like an oil pump. It secretes sebum to keep the hair and skin supple. But if that well gets contaminated, you've got a recipe for a boil.
To be exact, the hair follicle is an invagination of the epidermis into the dermis. The sebaceous gland sits on the sloping undersurface of the follicle. When a boil forms, it's an infection of that specific unit, the hair follicle and its associated sebaceous gland. On an exam, they might ask about the erector pili muscle too. That's the smooth muscle that causes goose flesh and actually helps squeeze the sebaceous gland to extrude sebum. In a boil, all that anatomy is under siege by Staph aureus.
I've seen boils get quite large, especially in areas with friction. But then we have the big brother of the boil, the carbuncle. This is where things get serious. I think of a carbuncle as a cluster of boils that have decided to join forces and go deep. Why does this matter clinically? Because a carbuncle isn't just on the surface, it's invading the superficial fascia.
That is a crucial distinction for the board exams. A carbuncle is a staphylococcal infection of the superficial fascia. That's the subcutaneous tissue or the fatty layer deep to the dermis. It usually starts in a group of hair follicles. Because the superficial fascia in certain areas, like the nape of the neck, is divided into compartments by tough fibrous septa, the infection can spread laterally and create a sort of honeycomb of pus. This is why carbuncles are so much more dangerous than a simple boil.
The nape of the neck is the classic spot. I once had a patient who thought they just had a bad pimple on their neck, but it was a full-blown carbuncle. They were even starting to feel systemic symptoms, fever and chills. It's amazing how a tiny hair follicle can lead to a systemic issue once the infection hits that superficial fascia. It reminds me of why I became a doctor of choice in my community. You have to catch these things before they become surgical emergencies.
It's all about the anatomy of the spread. In the superficial fascia, there are blood vessels and lymphatics. Once the bacteria get that deep, they have a highway to the rest of the body. Also remember the high yield fact that the dermis is thinner in women than in men, and thickness varies across the body. That's why you don't see carbuncles on the palms. There are no hair follicles there.
Great point. No hair, no follicles, no boils. It's simple but brilliant. So when we see a patient with a red, hot, swelling area, we need to ask, is it just the nail fold? Paronychia. Is it a single hair follicle? Boil. Is it a deep, multi-headed monster in the fatty tissue? Carbuncle. Sarah, any last high-yield tips for our listeners before we wrap up?
Yes, if you see a question about healing, remember that the skin appendages, the hair follicles and sweat glands are the keys to regeneration. In a partial thickness burn, the new skin actually grows back from these deep epidermal remnants. If an infection or burn goes deeper than the sweat glands, you're looking at much slower healing and likely scarring because the source coat for the new skin has been destroyed.
The source code, I love that. The sweat glands are the deepest reaching appendages, so they're the last line of defense for healing. Clinical anatomy is just the best, isn't it? It takes these abstract definitions and turns them into a roadmap for treatment.
It really does. To summarize for our students, paronychia is the nail fold. A boil is the hair follicle plus the sebaceous gland. A carbuncle is a multifollicular infection that invades the superficial fascia, most commonly at the nape of the neck, and is almost always caused by Staphylococcus aureus. Perfect summary. Know your layers, know your appendages, and you'll know your infections. Thanks for joining us, everyone. We'll see you in the next session where we dive deep into the fascia of the neck.